The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Hello and welcome to another edition of CHW in Action. If you have been watching us in the past, then you know for about a month or so we have not had a new TV show. It's because we were having some changes. We're going through a time of transition. And that's why if you notice in the background is different. Because when I started doing this TV show, I am a CHW, but I was a CHW for an employer. Now I am an independent CHW, because I simply want to do all that I can to make Nashua a healthy community. And as you know, CHW stands for Community Health Worker, and it's in action because I'm always in action to bring you health education, health news, and interesting guests that can help us all become healthier. So today I have the privilege of having a young lady. Her name is Yokasta, and she is a really nice lady, very professional, very intellectual is how I like to say. So I'm very happy to have her with us. So let me introduce you to Yokasta. Yokasta, how are you?
I'm good, thank you. How are you, Rafael?
Thank you. No, I said Yokasta because I want to make sure I don't kill your last name. What is your full name and your title?
My full name, Yokasta Campana, or Yokasta Villar Campana, and my title, I'm a registered nurse.
Excellent. Now, I know you just a little bit, but let's, for the audience, tell us who you are and where you come from. Tell us a little bit about your background.
For my background, well, I originally am born here in the United States, come from Dominican parents, Dominican from your country, and I've been in Nashua for most of my life. From New York City, we moved to Nashua when I was actually 6 years old. I've been a nurse for now 10 years, and I've been working in different areas in nursing. I've been working in nursing homes, in a hospital. I've worked in all sorts of different jobs within the nursing field.
And what do you like about being a nurse?
Helping people. Just as simple as that. I love it. It's a challenge every single day. Every single day you go into work, whether it's the field inpatient or outpatient, it's very different. And every day you don't know what to expect. Every day you learn.
Nice. And what motivated you to become a nurse? I mean, now we know that you like helping people, but when you decided to go for nursing, what was the main motivation to do that?
What actually brought my interest into becoming a nurse was my aunt actually became very ill. She had cancer, and she was in her terminal stages. I saw her struggle through that, and that just, I looked at the nurses and how much they helped her with her pain, with her suffering, and that I just wanted to be somebody that could be there to help others.
Very good reason. Now, the way that you and I met is because you are starting up Bell Tower Home Healthcare Services. And I want to give you the opportunity to tell the audience, to tell all of Nashua more about Bell Tower, you know, what its mission is, where it comes from, what drives it. So can you tell us what you do within Bell Tower and tell us a little bit about how the company came to be?
So I manage all the clinical aspect of Bell Tower Home Health along with my business partner. And Bell Tower Home Health, we provide skilled nursing services, so including registered nurse, LPNs, LNAs, and therapy, speech therapy, occupational therapy, and physical therapy. Our mission is pretty much to provide the best possible care that we can to our community, all of Southern New Hampshire community. We're specifically out of Nashua, New Hampshire, just because this is where I pretty much grew up. And I just felt that there was a big need for home health services, and specifically in the Latin community, in the Hispanic community, for people, which is a big community, a growing community. So I just thought that bringing nursing in Spanish in their own language to people's homes could help them become healthier people.
Beautiful. And how is it going to get the business up and running?
It's a long process. Anybody that goes into healthcare business knows it's a long process, but it's definitely going, and it's going very well. We have had a very good. The community thinks that what we're doing is very good and is very needed in the community. So we've had very good response.
Very nice. Before we went live, you were telling me about a success story. So tell me from the beginning to now, tell us about you when you made a presentation at Lamprey, a place that I love. And now, after a couple of weeks, we have a referral. Is there, you don't have to tell me the details, but just that you went and made a presentation, and out of the presentation now, you have an opportunity to help a new patient. And I'm HIPAA certified, I know you're HIPAA certified, so we don't want to get into details. I just want the audience to know that you guys offer such good service and do such a good presentation, that you've got a local health provider, in my opinion, one of the best local health providers, to now work with you.
Yes, we are working very hard to build relationships with the different physicians and the different practitioners and providers in the community of Nashua and Southern New Hampshire. And yes, we are very excited that people are actually giving us the opportunity to go into the different clinics and the different facilities and present our services. And we are very excited to actually now be given the opportunity to help out the community and the patients that very well need it.
I'm happy to hear that. And I just wanted to ask you that question because, see, right now this is my first TV show as an independent CHW. But I would have not been here if it hadn't been for Lamprey giving me the opportunity to come to Nashua and become a CHW. So I know how good Lamprey is at helping people, and I know how good you guys are and will be even better in helping people. So it was my pleasure to bring you two together. But I won't ask more about that. I won't go into too many details, okay? But the idea is that you want to grow Bell Tower into the whole Southern New Hampshire region.
Yes.
So you are aware of the need in the whole field,
Yes.
but specifically in the Hispanic community, because we know that there's, let's just say that there could be more health services catered to the Hispanic community, if we can use that word.
Yes, from the time I moved here several years back, until now, there has been a very large incoming community of Hispanics and of all ages, elders, disabled Hispanics, and they don't really have, I guess, the caregivers to be able to provide education in their own language and to be able to provide all the needs that they may, all the services that they may need in their own language. So, I mean, we're here to provide that, which is great.
Excellent. Now, how long have you guys been in existence?
A year, a little bit over a year now.
Okay. So what is the main goal for, let's say, for this year for the company?
The main goal for the company, to get our name out there and to be able to show the different clinicians that we are able to help their patients, and we are able to prevent hospital readmissions, and we're able to prevent, or not necessarily prevent, but help in basically the chronic care that these patients need, and all the education, everything that they may need in their own homes, rather than patients ending up back in the hospital and in a nursing home. We can help their patients stay in the comfort of their own home and with their families, which is our main goal and our main mission, just maintaining patients in their home.
Very, very nice. Now, what motivated you? Say you have a business partner. So what motivated you guys to choose the name of the company?
Actually, the name of the company is both of our names translated. So Bell Tower, Campana is Bell, and Tower is Torres. So it's combined together, Bell Tower.
Interesting.
Yeah.
Very, very nice. Okay, so what would be a typical way for someone to become a patient of Bell Tower? What would be the process?
What would be the process? We could get referrals from anywhere, basically. We just need the patient to actually qualify with their insurance if it's a Medicare, Medicaid patient, which we are working towards becoming a Medicare accredited agency, and we should be by the end of the summer. They just need to qualify under that. So basically they need to be just needing the home health services, have, if they're Medicare, being homebound is one of those criteria. or be disabled, and not being able to get those services on an outpatient, whether, if it's something like physical therapy, occupational therapy, we can bring those to their home. These patients typically have a lot of chronic issues and need management with their health care, such as congestive heart failure or hypertension, or they've had strokes in the past and they need management with any cardiac issues, are the different types of patients that we may be seeing on a day-to-day basis.
Okay. And who would help those patients? Would you be the one, or?
Well, we have different clinicians. We have RNs, LPNs, LNAs, home health aides. The RNs and LPNs will be doing the education as far as all the chronic care management.
Okay. If I may, I want to apologize. That happens to be my cell phone. I always remember to lower it down, but this day I came straight from work to here, and I made a mistake. So my apologies. If you excuse me for 1 second. No, I'm going to have to edit that out. This photo was kidding.
But you're
Whoa. Okay. Of all the times, Jesus. Don't worry, we can edit that stuff out. This photo was falling asleep. Okay. Okay, we're still on. Don't worry. No worries. Okay. Okay. Sorry about that. Okay. So you were telling me about, the question was, who would help those patients?
Who would help those patients? Our team, the registered nurses, LPNs, LNAs. We all work in collaboration with the primary care physician or primary care provider of the patient. We follow a plan of care that the doctor or the clinician that takes care of this patient will be signing off on, and we collaborate together it's a team effort to help this patient, whether it's clinical or social aspects. We work together.
Excellent. Now, what would guide a, let's say, healthcare provider, to choose you as opposed to another home care agency out there?
Okay. Well, I guess the big difference at the moment right now is that we are able to provide services in Spanish, skilled services in Spanish. So we have registered nurses, LNAs, and LPNs that are able to speak the language, which is a huge thing. There's a huge gap when it comes to somebody, needing an interpreter rather than giving direct instructions. There's a big gap in there. Also, culturally, being able to connect culturally with the client it helps a lot when it comes to education. So that's the big thing. Second thing is we are a small company, so we're concentrated very much on maintaining a relationship with the patients and maintaining just a relationship with not only with the patient, with the family, with the whole care team, which sometimes it's missed when it comes to having a big agency come in. Sometimes they have a different nurse come in every day. With smaller agencies, you have more of that continuity of care. You have the same nurses coming in, the same aides coming in, which helps a lot with not leaving any gaps in that patient's care.
That's very nice. So it's sort of like that patient will feel connected to whoever is helping them because it's the same person. There's a level of continuity, right? I like that because back in the day, I used to be a Spanish medical interpreter. And I too had to go into rooms and hospitals, and I had to interpret for someone who had a different interpreter there. And you could see, I could see that the patients were not all that comfortable with that. The families were not all that comfortable, but they didn't have a choice. And an interesting thing, one reason why I like what you guys want to do is because a lot of times when I would go to do an interview, before the doctor would come into the room, the parents of the kids, when I was interviewing for kids, the family members, and even the patients, they would be very talkative. They would talk a lot about what the issues were and the history of why they were there and so on and so forth, and the things that they would like to say to the doctors. Then when the doctors came in, they became silent. and they would only answer yes or no. They would be very careful about giving detailed information. And as an interpreter, I couldn't tell them what to say. I couldn't advocate. So then, that's one of the reasons why I became a CHW, a community health worker, because now if I'm doing medical interpretation, I can do the slow down sign and tell the patient, would you like to bring this up? And tell the doctor, I think that this is what the patient means, and then confirm it with the patient. So that's why I think that if a patient had access to healthcare in their own language, I think that would be a plus.
Yes, definitely.
Have you had any experiences like that? Where you've seen, when you've gone into, because you used to work at the general hospital.
I still work at the Lawrence General Hospital, which a great part of the population are Spanish speaking. And it is extremely important as a registered nurse working in an acute care facility. Many times I would go into a patient room and they would completely misunderstand the information that was given to them, even if a translator was used or one of those voice
The language line.
The language lines were used. There's a lot of information missing. A lot of times patients get they get uncomfortable and they don't disclose a lot of the information just because of the language barrier and because of the gap there. So once they saw me, a Spanish-speaking person just like them, and being able to provide the information in Spanish and being able to understand culturally as well, it helped a lot with the understanding of their healthcare and their needs. So
that's an important point to make aware of to the healthcare providers, because when you go into big hospitals, the primary mission is to help that patient, and sometimes they feel that, and this is my opinion, because I've gone to hospitals to do medical interpretation. The main mission is we want to help the patient become healthier. So we have access to this language line. And because the patient is listening to someone speaking their own language, the doctors, I would say, believe that the patient is being serviced at the utmost quality of care. When in reality, people are inside, a lot of people have told me they're inside wishing that they could speak to someone directly in their own language.
yes, it's definitely you need that personal connection. Somebody actually being able to speak to you in your own language rather than having to speak to somebody in a phone and not knowing whether that patient truly understands there's different dialects too in different languages, so sometimes there's that miscommunication there, and a lot of times it's missed, when it's somebody on a phone rather than somebody in front of you. It's missed that they speak different dialects and that saying one word means completely the opposite in different countries, although both countries speak the same language. And it's a lot easier to be able to pick that up when you're speaking to somebody personally rather than on the phone.
It's a huge difference. So now you just said that you're still working at General Hospital.
I still do work there at Lawrence General Hospital per diem.
Okay, and do you do any type of home health care at the hospital, or are you only at the hospital?
No, I don't do any home health care at the hospital. I actually work in the intensive care unit.
Okay, so then going into home health care, that's something that you're doing because it comes from inside of you, or you want to try something new, or?
I have worked in home health care previously, and I really enjoyed it. I really enjoyed going to the patient's home and teaching and being able to assess the patient in their own homes and help those patients stay in their own homes and going into a patient's home and going over their plan of care and doing the education. I think doing this would give me the opportunity to help a lot of the chronic care patients, chronic issue patients, prevent them from going into the hospital and end up seeing them in the intensive care unit in the worst of their position. A lot of times they end up in the intensive care unit or in acute care because of miscommunication or lack of medication adherence, simple things that could have been avoided by a home health care provider. So I think home health care is very important, and I think I just really believe that this community needs that, and I want to make a difference, and I guess that's where I found I could make most of the difference in our community.
I'm glad you feel that way, because really the reason why I do this TV show, the reason why I became a health promoter, as they call it, CHW, is because I see that need, not just in Nashua, in the whole southern New Hampshire region. We Hispanics are growing in numbers. And I refer to Hispanics because we're Hispanics and we speak the language and we know the culture. But you also have a lot of new Americans, a lot of refugees that are coming into Nashua, and not just Nashua, other cities within the southern New Hampshire region, and they are having that situation in which they need medical care and they have to use the interpreter services, or the health providers has to use the medical, the language lines, and then something is lost there. That personal touch is lost a little bit. So there's a big shift going on in New Hampshire, from what I see, into helping people become healthier, more on prevention rather than in management.
Yes.
So, and you've seen that too?
Definitely. I think that prevention, I mean, it's something that's been studied. Prevention is the key to help the community be healthier, and not only help the community be healthier, but decrease costs for all of us. Basically, at the end of the day, it's all of us, and preventing the unnecessary, not necessarily unnecessary, but preventable readmissions into hospitals. And home health care plays a huge role in that.
So what is your vision for this Greater Nashua community health-wise?
My vision for Greater Nashua community health-wise, it's just to be able to educate and just have a healthier, more educated community as far as their health care. Not only with patients, but I also want to be a role model for those young adults that actually want to come into healthcare field. And I think having a company where we embrace education and help not only our patients, but help those who work for us become more educated and kind of, grow into whatever they want to grow into within the company. Just make the whole community better as a whole. So not only patients, but also our employees.
So you want to invest in your employees?
Definitely. I think if you want to have if you're going to have a healthier community, and you're depending on your employees to be able to teach our community to be healthier, our employees need to be well taken care of as well, and they need to be very well educated, and the resources need to be provided to them as well.
Very nice. And speaking of employees, are you guys hiring right now?
Yes, we are. We are looking for LNAs. We're looking for nurses, and not only Spanish speaking, if any languages, or if you only speak English, that's perfectly fine. Everybody can teach somebody something. So.
See, that's what we want to emphasize. That yes, we have the Hispanic community in our hearts because we're Hispanics, but Bell Tower is for everybody.
Yes, definitely for everybody, not just for Hispanics. It's for a whole healthier community as a whole. It's a plus that we speak Spanish for those patients that speak Spanish as well. But we're here for everybody.
You know what I like about Bell Tower is that I see it becoming this hub where you have different people from different cultures, different diversities, different ethnicities coming into the healthcare field and be able to care for one another.
Yes, that is our goal. We look to recruit people that speak different languages and are able to serve people within the community in their own language.
Beautiful. Okay, so right now, let's see, for someone in the community that might have a need, let's say someone that is homebound, that might be able to use the Bell Tower services, how can they connect with you? How can they reach you?
Well, they can go on our website, so belltowerhhc.com, and right there we have our phone number, 603-821-7421, or you can just call it at any time. Leave us a message. We'll give you a call back. You can go to your primary care physician, and if your primary care physician agrees that you could definitely benefit from home health services and you qualify for the services, then they can give us a referral. So it comes down to the patient needing it and the patient going to their primary care physician, letting them know that they have a need or expressing their concern. And if that physician agrees or that physician recognizes that they could use our services, then you contact us, you give us a phone call, you fax us, leave us a message, whatever.
So the key is that health provider. We want a
Yes.
health provider to make the call.
Yes.
Okay.
Yes, at home health services, it's something that is ordered by the physician at the end of the day. So.
Okay. Interesting. I can see that you're personally invested in this. Where do you draw your passion from?
Where do I draw my passion from? My passion is just from trying to help the community. I have a vision to become a better nurse, to educate other nurses, and to enable them to become better nurses and educate our community, our patients. My passion also comes from being a better professional and to be able to be a good example for my family, for my daughter. I have a 2-year-old daughter, and I would like for her to say one day, "That's my mom."
Nice. What is her name?
Mia.
Mia.
Yeah.
Nice name.
And I just want her to be proud, and I want her to see where I came from, and I come from a single mother family home, four daughters, and she worked very hard to raise us. And we all worked through college very hard, 2-3 jobs, and now we're here. And I just want my daughter to be able to recognize that and see that.
Wow. See, now I respect you more. Okay.
Sorry, I become emotional.
No, it's a beautiful thing. It's a beautiful thing. See, and that's what I like about Bell Tower. It's like real people trying to help other people. So, no, hey, let's say thank you to your mother. Look at what example she gave to you.
Yes.
And now you're giving it to your daughter.
Yes.
And your daughter will give it to her daughter.
Yes.
So it's like a generational thing.
Definitely.
Very
nice.
nice.
I just want other young adults, that have been in our situation to recognize, that the resources are out there and that people like you and me are out there to help them, recognize what the resources are and become better people and help the community.
It has been such a pleasure to have you in the show. If you wanted to send a message to the community, the natural community, what would you say?
What would I say? I guess that there's always something to, I guess I don't really know what specific message I would send out there other than there's definitely resources out there, whether it has to do with your health or with your education or whatever it has to do with. There's resources out there. You just have to know where to find them, and you have to know where to find the people that can help you. And we are here, and we are here to help the community and help you in whatever it is that you may need. Specifically, Bell Tower, we're here to help you with your health needs and your educational needs, and just to become better, healthier people.
Well, nice. Well, thank you so much for having been with us. I appreciate your time.
Thank you for letting me be here.
My pleasure. And thank you for giving us some of your time. We sincerely appreciate it. As you have seen, that TV show is taking a new angle on being more personal. We want to be people helping people, people offering health information so that we can all be healthy and have a healthier community. A healthier community is a prosperous, more prosperous community. So when I think of Nashua, I think of a healthy Nashua, a prosperous Nashua, and that can only happen if we all come together. And that is why I truly and sincerely appreciate your time. I wish you the best. May God bless you. Your friend, Rafael Calderon.
The preceding program is provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, Board of Directors, or underwriters.